Epidemiological presentations at WCCS highlighted how the incidence of skin cancer, including non-melanoma cases, has increased worldwide. In areas of high incidence, this places a significant burden on the patients, health systems, and society. In fact, new data presented at the conference showed that the presence of actinic keratosis can significantly impact patients' quality of life. We spoke to Professor Veronique Marmol and Professor John Hawke about the role of public awareness campaigns, and to Tom, an actinic keratosis patient, who shared some of his own experiences at WCCS.
I don't think there's the same level of awareness of non-melanoma skin cancers amongst the general public. Most of the general public do tend to think of cancers as being mole cancers, which is probably a good thing because they're the most aggressive and potentially fatal. But non-melanoma skin cancers are very important for various reasons. One is that they're a major cost to the health services of countries, and they can be treated easily at the beginning as well. And secondly, it's been shown that they do cause a significant sort of diminution in the quality of life of the patients. Early detection of any disorder is a good thing, because as any disorder whatsoever progresses, it becomes more difficult to treat. So non-melanoma skin cancer is very easy to treat in the early stages.
I was diagnosed some 10 years ago. At the time, my principal reason for attending my GP was that I had a sore on my back, which turned out to be BCC, basal cell carcinoma. And it was only in pursuing that particular interest that the AK was identified. Well, in my case, after 10 years, I have to say yes to that. It's a long-term condition. I have had periods of relief over those 10 years, but basically it's been there for the whole 10-year period. I'm more aware. I mean, I'm very careful now. I always wear a hat. I always make sure I have sun lotion on. And so I'm aware of it and anxious to ensure that it doesn't worsen. Two simple pieces of advice. The first is that you should always take any issue like this immediately to your doctor. As soon as you identify an issue, take it to your doctor and hopefully get a referral to a dermatologist. Equally, my advice would be that specifically, if you have a sore that is not healing, that's one that you should look at much more closely and try and get a proper treatment for.
Noted as an emerging field in dermatology, the psychological impact of actinic keratosis or a non-melanoma skin cancer diagnosis was discussed during a session run by the European Society for Dermatology and Psychiatry. Research has shown that impact on leisure time, changed appearance, sense of illness and loss of control are common patient perceptions of AK, coupled with feelings of worry, fear and guilt. Associate Professor Martina Ulrich and Professor Veronique Marmol share their perspectives on effective recognition of psychological and psychosocial comorbidities and how early diagnosis and effective treatment can have a positive impact on patient outcomes.
At the beginning, the first diagnosis is quite easy, but many of these patients will present other skin cancer, and there it affects their psychological life. It's important also that they understand that there will be follow-up. They need also to change their habits with the sun. They have to prevent more exposure. And it's pending also how it affects the physical aspect. I'm sure that more information is needed for patients, because also to decrease their fear. You know, when they have the diagnosis, they do not really understand, and after that they do need to read, to have more information just to understand the gravity of this problem, what will happen to them. So it's very important.
It can affect the patients quite severe, because the patients get a cancer diagnosis. And as a dermatologist or also as a GP, you have to be very careful, because the patients they hear the word non-melanoma skin cancer. And they might get this confused, and they might go to the internet, and then they are very scared. More and more of my patients get more younger all the time. And it's also a big problem for them because, you know, when you are 35 and you're diagnosed with the first basal cell carcinoma, it can be really sure that you will have many more BCC and AK in the future, and many of these patients develop them. And so, you know, they are looked at on their face, they have spots, you know, it affects them. I mean, the very simple questions is how they feel, if they are impaired in their daily life by this disease, if they are afraid of it, if it's just a cosmetic problem or if they really think that it can get more severe. And I think if patients really had a long history, they know better what they have, they get a feeling for the disease, but it can also be scary.
Euromelanoma is a campaign providing information about diagnosis and treatment on skin cancer. And this campaign was initiated in Belgium, but now it's in many countries. And the idea is a common campaign just to provide information for all the people in many countries, translated by the doctors. After that, we have a screening in some of the country. And this is the idea of really increase the awareness about skin cancer. I think it's important because skin cancer can be seen. So more you increase the awareness, more you see picture, more you speak about, more people are coming to have an early diagnosis.